I'm going to introduce Jenny to you. She is a fellow colleague here in Atlanta. Jenny Askew is the founder and CEO of the Nutrition Center for Digestive Health. She is a business owner, wife, mom, and cancer survivor. She is a registered and licensed dietitian, certified ACSM exercise physiologist, who worked in the health industry and wellness since 2006. She's helped hundreds of clients improve their health and well-being through diet and exercise. And her passion is fueled by her desire to help others discover the root of their health issues. She has a Bachelor of Science in Kinesiology, exercise leadership degree with James Madison University, Master of Science from Georgia State, certified LEAP, MRT, food and dietetic specialist, health screener, and she was a contractor for a nutrition program coordinator for the CDC. So she and I have connected, and I just love her approach. She's very approachable as a practitioner, and I invited her to come this year because of her experience and her passion for nutrition and finding the root causes of problems. So Jenny, thank you for coming today.
Yeah, thanks so much for having me, Dr. Erin. I'm so excited to be here. We are going to be looking at the connection between the gut and the skin today. I've got a lot to say on that. And I really think that as estheticians, you guys are uniquely positioned to really play a big role in healthcare and improve people's health. And I'm really passionate about that. So I'm excited to kind of hopefully expand your view of your role in helping people feel better and, of course, look better, but also, kind of being a starting point for helping people make deeper connections about their skin and their health in general. And I want this to be interactive. So if you guys have questions along the way, feel free to pop those into the chat. As Dr. Erin said, I am a registered and licensed dietitian. I've got a master's of science in nutrition. I have 3 years of integrative and functional nutrition training that I pursued after getting my master's degree. And it all stemmed from some health issues that my husband went through. I don't think there's a functional practitioner out there who hasn't gotten to where they are without going through a health struggle themselves or having a loved one go through a health struggle. People in the functional space have usually kind of been there, done that, and had to find their own way because of, the missing pieces that are in the conventional healthcare system. I have a Bachelor of Science in Kinesiology. I'm an ACSM certified exercise physiologist, a cancer survivor, a wife. I'm a mom of 2 kids, and I've been in private practice for over 12 years. My clinic specializes in digestive health. We really work with people who have hard to solve digestive problems and either do not want to be on medication their whole lives or aren't happy with just having to live with symptoms. It's really people who have been to doctor after doctor and have not gotten any real reasons as to why they don't feel well or to why they can't get their symptoms to resolve. It's a pretty unique population. By the time people get to us, they're pretty burnt out and really are looking forward to getting the help that they need to feel better. And we do that by finding the root causes of their health issues. So I have a couple of dietitians on staff and a really awesome virtual assistant. And we see a pretty good caseload of clients. We probably see about 15 people a week, and we're really working on solving digestive issues. And a lot of times with digestive issues, there's lots of other things going on. So we specialize in digestive health, but we certainly deal with a lot of other conditions as well. Today, we're going to be talking about functional nutrition. We're going to be talking a lot about the microbiome, the immune system. We're going to be making connections between the gut and the skin. And a lot of it that's going to come up are going to be inflammation, dysbiosis, and leaky gut. And then we're also going to be connecting common skin conditions to gut health and providing nutrition tips for skin health. And we're going to talk about how to do that as an esthetician while staying within your scope of practice. So functional nutrition, does anyone know what functional nutrition or functional medicine is? You want to type it in the chat, how it differs from conventional medicine?
No takers.
Anybody want to take a guess?
Root
Yeah, root
cause.
cause medicine. That's good. Yeah, that's a good way to put it. So with functional nutrition, we are really looking, to get to root cause solutions for people. Why is my slide moving forward? There we go. And it's an evidence-based approach to nutrition and health that's very personalized. If you were to look at our list of clients right now, we don't have any two people on the same diet. We don't have any two people taking the same supplements. And that's because when people come to us, no one has the same set of imbalances as someone else. They might have similar things going on or some crossover in some places, but everyone is so different. And it seeks to improve your overall well-being and manage disease by getting, again, to the root cause of your symptoms. And this is where it really is different from conventional medicine because we're looking to prevent disease and optimize wellness. So we try to catch things. One place we're really picky at is with labs and where lab values should be for different markers. And we try to catch them when they're going out of range versus when they're way out of range. So we try to act when there's smoke. Conventional medicine acts closer to when there's a fire actually going on. So we try to get ahead of things and to optimize. And we're really looking at the systems of the bodies being interconnected. And this usually includes targeted dietary interventions, supplements, and we work a lot with lifestyle modifications too. And then we use functional foods. These are foods that have very specific health benefits based on nutrients and other components. We do work a lot with supplements and testing in our practice, but we also are really a food first practice where we're really looking at diet, optimizing that, and then kind of using the other things to optimize overall health and to get people answers. And I just think this is a really cool illustration of what we're looking at when we think about the body, and it actually flows really well after the last lecture, thinking about the body and plants and how there's so much crossover in nature and how we're really all so similar. But this is just kind of showing health from a root cause. We're looking at the body as all one piece and trying to identify imbalances versus the conventional method where there's a different doctor for every single symptom or system of the body. This is looking at the body as a single unit, which is really, really cool and really, really helpful. And nutrition is not one size fits all. We're really looking a lot at bio-individuality. It's a big word. It's just the fact that we are all individuals. Like I said, no one in our practice, none of our clients are on any of the same plans. There might be some crossover, but it's all going to be, everyone needs something a little different because everyone is different. And you know, an approach that works for one person might not work for someone else, and that's for lots of reasons. Genetics, it can be a really clear, clean example of that. Everyone has different health conditions, right? So that can drive different dietary recommendations. Everyone's microbiome is going to be very different. So one person might be lacking lactobacillus bacteria, and another person might not have enough Akkermansia. You don't know these things unless you're testing. But there is a whole lot of diversity, and we live in a world where a whole lot of things affect our microbiome. Socioeconomic factors, right? What works for one person's budget might not work for another's. Cultural influences certainly dictate dietary choices. Lifestyle and age plays a really big role in differences as well. So when we talk about the microbiome, There's the skin microbiome, which you guys, I'm sure, are experts on, and those are the microorganisms that are on the skin surface and contribute to health by protecting against harmful pathogens. And then there's the gut microbiome, which is a community of microorganisms in the digestive tract. They help with digestion, immune function, overall health. And just like the skin microbiome, there are beneficial bacteria that help to prevent disease by taking up space in the digestive tract. So the skin, of course, is the largest organ in the body. There's lots of areas for colonization and different types of microbial communities. The skin microbiome, of course, plays a role in immunity and has been shown to have over 1,000 different species of bacteria. The gut microbiome has the highest diversity of any other organ in the body. Microbes colonize the gut at birth. So some of the things that we're asking about when we see clients, because it does go back this far, is what type of birth were you, brain, vaginal, or C-section? Vaginal births, the babies get more good bacteria from the canal, from the mom. So that kind of puts you at an advantage in terms of your gut microbiome later in life. Breastfeeding versus formula feeding affects it too. So sometimes if someone can't figure out why they're having so many digestive issues, we go back that far to literally day one, which is really interesting. And there's lots of things that affect the gut microbiome. So I think at this point, just the world that we're in, we're all kind of at a disadvantage because of the way that diets are in America and because of the overuse of antibiotics. You know, and the older you get, the more likely you are to have gut issues as your stomach acid levels decline. And I mean, who is not stressed out these days, right? That's a pretty big thing too, and that negatively impacts the microbiome. So if we want to have a healthy gut, we really do have to work hard for it. And there's lots of ways that you can achieve a healthy gut, but it's not uncommon. And I think most people are probably on the disadvantaged side of gut health because we just have so many things working against it. But there's lots you can do to support it and to colonize it well. So with the gut and skin connection, there's going to be like 3 common themes today, as I mentioned earlier. Inflammation, dysbiosis, and leaky gut. We're going to be talking about these a lot. Any questions at this point? Let's see, I see a couple of things in the chat. Yeah, looking at whole body. Cool. Okay. Let's see. So, okay. So we have the gut and skin axis, and this is the connection between gut health and skin health. And this is where imbalances in the gut microbiome can influence skin conditions. And in skin disorders, it's found that not only is the microbiome altered on the skin, but it's also going to be altered in the gut. So as estheticians, you guys need to be thinking a little bit deeper here and really encouraging people. You know, you've helped them from the outside, but they also need help from the inside. It's kind of a two-way, 2 things causing skin issues here, especially the specific ones we're going to look at in a minute. Certainly the work you do is helping, but if you can kind of boost their chances of being successful and people having healthy skin from the inside, it's really going to be an awesome combination. So with the microbiome and the immune system is regulated by the microbiome, and an imbalance in either microbiome in the gut or the skin initiates an immune response. So in either place, we're going to have the immune system kind of flaring up and being irritated if there's an imbalance. And the skin conditions that this really shows up in, dermatitis, psoriasis, acne, dandruff, and even skin cancer, we can see imbalances in these microbiomes. And this is just showing different microbial compositions in the skin and the gut. There's bacteria that are associated with healthy conditions that you want, and then there's bacteria that are associated with things that we don't want. And that will end up causing digestive problems, especially in the digestive tract. There's a lot of misconceptions too about the gut and skin axis. A lot of people think that probiotics will solve everything. That's not true. They can definitely be beneficial, but they're not a cure-all. Really, a combination of healthy diet, lifestyle changes, and getting to underlying imbalances is really important. And it's also important that the correct probiotics are being taken. And the more we learn about probiotics and the microbiome, the more this is really, really becoming something that we see a lot where right now I have a client who's been on the same probiotic for 25 years. And that, for example, is a huge no-no because, and we're working on it, but we have so many different types of bacteria in our intestinal tracts that the best practice really is to rotate probiotics. Doctors like to throw a line at everything. Not always helpful. Sometimes it's the right answer. The more you know about someone's microbiome, the better you can make an educated decision or a targeted recommendation for them to be taking the correct probiotic, but you can't just throw a probiotic at any sort of skin condition or digestive issue even. Some strains of probiotics will even make digestive symptoms worse if you're giving them to the wrong person. So this is certainly something that should not just be a one-size-fits-all probiotic for everyone. It's very different. A lot of people think that one diet will fix all the problems. Not true. Certain diets can make some conditions worse, especially digestive problems. Some people believe that diet or detoxing will clear up skin issues. Sometimes it can be very true, and sometimes it can make things a lot worse. Detoxing is very nuanced. We need to think about supporting all facets of detoxification. There are several organs involved. It's not just the liver. So really that needs to be overseen by someone who is experienced with detoxing and can really support someone through that. And nutritional needs are really individualized. So there really needs to be a balanced and personalized approach. You need to be thinking about things like food allergies, medical history. There's just a whole lot that goes into, stage of life too. That goes into nutritional needs. And skin issues are surface level is not true either. Gut health plays a really important role in skin health, and imbalances in the gut can, of course, manifest as skin issues. So while working on skin is helpful, if we really want to get to the root cause and help people have healthy skin, we've got to be working on the inside of the body too. So some gut issues that are associated with common skin conditions, there's pathogens, the overgrowth of opportunistic organisms is what we're talking about here. And that can be bacteria or yeast as examples, and there's specific bacteria. Yeast is also called candida or candidiasis. So it's kind of all the same group of things there. Not having enough good bacteria. One round of antibiotics, you guys can wipe out good bacteria for 6 months. It can take the gut 6 months to recover from a single round of antibiotics. So anyone you're working with, specifically right now, I have a case going on with acne, and the girl also has SIBO, which is a small intestinal bacterial overgrowth situation. But anytime you're working with someone with digestive issues and skin issues, you really want to be thinking about the history of antibiotic use too, and asking about that if you can, just to try to help get them some clear answers and guide them in the right direction to someone that can help them. But we certainly see a lot of acne, especially in girls who have a high history of antibiotic use and also birth control use too. So those are some kind of flags to look out for: poor digestion, inflammation, leaky gut, and then of course we have celiac disease that shows up on the skin, as well as non-gluten, non-celiac gluten sensitivity too. So there's lots of overlap here where we're seeing gut issues show up on the skin. And in terms of inflammation, this is the immune system's response to injury or infection, and it can protect against harmful pathogens. But chronic inflammation due to gut imbalances can damage overall health, and we certainly don't want that for the people that we're caring for. And by chronic, I mean it's lasting for prolonged periods, like weeks, months, or even years. So we really want to be on top of these things. If you're picking up on something that, you know, someone might have a more serious condition going on, we really want to make sure we get them referred so that they can start improving their health from the inside out. In terms of gut health and inflammation, dysbiosis can trigger inflammation in the gut, leading to skin issues. And then inflammation from the gut can weaken the skin's barrier, making it more susceptible to irritation and also infection. So when we're thinking about inflammatory conditions, rosacea, eczema, and acne, they often correlate with inflammation caused by imbalanced bacteria in the gut. And then managing gut health with diet can be really, really key for preventing and managing inflammatory skin diseases. So some nutritional strategies for inflammation, and a lot of the things I'm going to talk about today can be recommended for anyone. And I'm going to bring this up again later too, but it's just really important. As an esthetician, you guys are allowed to make dietary recommendations that are generalized. They can't be specific to a person. So anything, I always, when I try to teach this to people, it's anything you could say to a group that would apply to everyone in a large group would be a generalized recommendation. But if you tell someone to specifically to pull something out of their diet or to focus on a specific nutrient, it has to be more general than that. So one thing that is just really good for everyone is following a low glycemic diet. And this is intentionally eating foods that have a minimal impact on blood sugar. So if you have a client with skin issues and they also have something like PCOS, where we know there's blood sugar dysregulation or diabetes, this would be a safe and helpful way for them to eat, but this is also a safe and helpful way for anyone to eat. So I think, you know, really looking at, you know, people's health conditions that they have going on and kind of thinking about their skin health and, you know, trying to get them to start connecting the dots too and really take ownership of their health could be really helpful. Reducing intake of saturated fats and trans fats. Again, this is beneficial for just about everybody. Probably most of America needs to do this. And increasing intake of omega-3 fatty acids. Those are normally found in fish oil. There are some plant sources, as we'll see later. But these certainly help decrease inflammation. And there's a really specific ratio of omega-3s to omega-6s that where they're in balance. Most of the time, most people have too many omega-6 fats in their diet and not enough omega-3s, which throws inflammation, but increasing those omega-3s should help decrease the omega-6s and decrease inflammation throughout the body. So those are positive changes just about anyone can make that will improve overall health and skin health. Eating fruits and vegetables, this could be a simple general recommendation that would be safe for most people. 2 fruits per day and at least 3 vegetables per day is a minimum. But you could even go up to 6 vegetables a day in terms of servings. More fiber, if one of your clients is ever consuming more fiber and feels worse, that's a red flag for a gut disorder, dysbiosis or SIBO. So that would be definitely something to refer them out for. And then also understanding that nutrient deficiencies play a really big role in skin health and can make skin conditions worse. Okay, and so we've talked a lot about gut dysbiosis, skin dysbiosis, also called cutaneous dysbiosis. It occurs when the normal amount, composition, or location of bacteria on the skin is altered. and it's typically due to a decrease in diversity. Diseases associated with this, atopic dermatitis, rosacea, and psoriasis. And there's evidence now that topical prebiotics, postbiotics, and oral probiotics can be helpful. It's also about matching the right person with the right probiotic. So I think that's important, but like, you know, it's just really interesting. We are seeing it becoming more mainstream to treat skin conditions from the inside out. Yeah, so how do you balance fruit consumption with a low glycemic diet? Yeah, that's a great question. So there are like some fruits, berries, for example, can be eaten with very minimal impact on blood sugar. And I would just, if someone's on a low glycemic diet and wants to have fruit, maybe like a couple servings a day, that would be like one of the people that are on 2 servings of fruit per day, and like a lower glycemic fruit. So I would be going probably for, you know, strawberries, blueberries, blackberries, things like that. Let's see. What my computer is doing. Sorry, here we go. Oh, okay, leaky gut. So this is also known as intestinal permeability. This happens when there is damage to the lining of the small intestine. And if you guys have questions about this or have ever, like, it's kind of a buzzword, but I love this illustration. It really shows you what's happening. So on the left side, we have a normal gut, where everything is intact. And on the right side here, there's a picture of a leaky gut where you can see that the cells of the small intestine are not touching. And over here, where everything's intact, they are touching. So particles of food and pathogens cannot get through here. But on this side, where the gut is leaky, particles of food and pathogens are able to enter from between the cells and then enter into circulation. So this is a problem because when you have things circulating around the body that aren't supposed to be, they can really wreak havoc and they can cause inflammation just about anywhere. So people with leaky gut can have a lot of kind of weird symptoms going on that no one can really connect. It might be like rashes, headaches, bloating, you know, fatigue. It's kind of like a weird mix of things that don't make sense. They don't necessarily fall into a disease category. And it's because they're just having random symptoms happen everywhere because there's inflammation that can be taking place anywhere in the body. So this is a really interesting situation. We're currently learning more about it and hearing more about it, which is great. I think it affects a lot of people. The reason that the gut becomes leaky, there's a lot. Dysbiosis, which causes inflammation, can be a factor. Inflammation in itself, just from diet, can be a factor. The role that gluten plays in this is that it increases zonulin production. Zonulin's a protein, and when there's too much zonulin, the junctions here don't close. So that's kind of how, you know, if you hear about gluten and leaky gut, that's why. Dairy is another common culprit with leaky gut. But this is really an underlying issue for a lot of people. So just decreasing inflammation and cleaning up the diet can go a long way here. But sometimes, depending on how bad the damage is, people really need more of a restorative workup. So it's a really interesting hot topic. There's lots of connections to the skin and the gut, and this is one of the ways that we see specifically skin issues starting in the gut. So yeah, like I said, common causes: diet, gluten, dairy, lots of sugar, processed carbs. Ongoing stress can be another cause, antibiotics and other medications, toxic exposure, plastic, as you guys know, self-care products, water, cleaning products, and air quality can all contribute to leaky gut. And this is a place where I feel like you guys have the position to step up and really encourage people to continue working on their health. It's great that people are in with you guys working on improving the condition of their skin, but you can help push them a step further in their health journey by finding a practitioner that can help them really get to the root cause of why they're having skin issues. I think it's hugely, hugely important. I think it puts you guys in a really unique position.
Jenny, can I ask a question?
Yeah, of course.
How would you advise the aesthetic pros the best way to approach a nutritionist? I mean, cold calling is not the way to go, but what would you look for in an esthetician if someone came to your office? What would be the best way they could present themselves to you?
To me,
Yeah, like to network. Let's say they
oh yeah,
wanted
yeah, yeah.
to, yeah, what would be the best way for them to go about, what would you prefer personally? If someone wanted to start working with you, what would an esthetician need to do to convince you to work together?
Yeah, so we take referrals from other healthcare practitioners. So, you're welcome to refer people to our office. And we're really good about communicating when we're sharing clients with people about the plan of care. So, if you wanted to work together or send clients to us, and they sign on and start working with us, we'll be in constant contact about how they're doing and what we're working on and what we find. Because it's really a two-way street. Like, it would be us helping the client, but also, helping the esthetician, and the esthetician would also be helping us, keeping in contact about the client's care plan. And one thing I think that's really interesting, as estheticians, I feel like you guys have a lot of insight as to what goes on with people. Like, I know I have an esthetician that I see on a regular basis, and it's just like a really relaxing environment. It almost feels like therapy, and it's just like a really like warm, great connection. And like we just when I go to see her, like we have the best conversations. And I mean, she knows a lot about what's going on in my life, and I know a lot about, what's going on with her too. We've actually become friends over the years. But my point is that, when you're caring for someone, you can pick up on things that might be going on with them that could be like contributing to their health and their health issues. So it's really a partner system, when we work with physicians and other healthcare professionals. Then we're, talking back and forth about clients and the best way to help them and what we're finding. So yeah, it's definitely, there's a lot of shared goals, and it's a really great approach to work together on things. And I think, we have the potential to help your clients, and you guys also have the potential to help our clients too. We're always encouraging self-care and relaxation and de-stressing.
Yeah, I think sometimes some of us may be a little apprehensive about approaching a practitioner because we don't know what to expect, or you don't just throw a resume at somebody. That's what I'm trying to say is, what if it wasn't your office, if it, as a health practitioner, what do you look for, or would you be open to as far as an esthetician approaching you? Would they need some sort of documents or case studies, or what would convince you, instead of them just saying, well, I'm an esthetician, I want to work with you? What would be an impressive presentation on their part to want you to start to work with them?
I think it's really understanding and appreciating how the skin is impacted from the inside and the outside, and really understanding why it would be a good fit to work with a nutritionist. So just kind of showing an appreciation for, what we're doing and understanding it a little bit, and also understanding how all of health is so holistic, and how, you know, the different parts of the body work together, and being able to pick up on things going on with clients that really, you know, warrant referrals.
Right. Okay. We have a question here. Would
Yeah.
joint pain be a sign of leaky gut?
Yes, absolutely. Arthritis, joint pain. Yeah, absolutely.
Okay. All right. Sorry, it seemed like a good time to ask that question.
Yeah. Yeah. I hope I answered it. Let me know if you guys
Yeah.
have any additional questions.
Okay. Thank you.
Yeah, of course. Yeah, so yeah, this is a really interesting, like the leaky gut and skin health connection is really interesting because it's kind of a cascade effect, and you can kind of see everything working together for better or for worse. But leaky gut leads to increased skin inflammation, right? Because toxins are entering the bloodstream. And this weakens the skin barrier, which leads to increased sensitivity, dryness, and irritation. And it may contribute to autoimmune skin conditions like rosacea and psoriasis due to the chronic inflammation that's going on. And what we find is that dietary fiber and probiotics can improve gut health and skin health by reducing systemic inflammation. But it's kind of like one thing leads to another, and then there's an autoimmune condition going on. So the sooner that people can get help for their skin conditions and really address it from the inside as well as the outside, the better off they're going to be. We don't want to wait until someone has an autoimmune condition. We want to catch it when it's like acne or mild eczema or whatever the case may be. But like it's like I said before, the body whispers before it screams. So the sooner we can catch it before there's lots of different things going on, the better for the client. So for leaky gut, some basic nutrition tips. Dairy, gluten, and added sugar. Most people would probably feel a whole lot better if they took these out of their diet. And most people, you guys, that don't feel well have not felt well for so long that they don't even realize that they're not feeling that well anymore. I don't know if you've ever been on a healing journey or heard about someone who has been on one where they're working on their gut health, but people will say, wow, like I had acid reflux for so long every single day. I didn't even realize that was normal because it was normal for me. And that's not normal. We shouldn't constantly be having digestive symptoms or, oh, I was bloated for so long. I didn't even realize I was bloated because I was bloated every day. That's not normal. We should feel good. We shouldn't have any weird things going on that are bothersome. Those are all kind of leaky gut type symptoms. So increasing anti-inflammatory foods, omega-3s, green tea is good for just about everybody. Lots of color in the diet to help with nutrient intake. Herbs and spices are always great, and avoiding processed oils probably benefits everybody. Focusing on healing nutrients. Glutamine is a big one. If someone has anxiety, we tend not to recommend lots of glutamine. That can make it worse. So again, these aren't one size fits all, but just in general, these things can be helpful. Collagen, probably pretty much everyone can do collagen as long as they're okay with animal products. Antioxidants and also healthy fats are always going to be a safe bet for people. If you are going to make any sort of food recommendations like this, make sure you have an allergy list from people because you don't want to be recommending omega-3s, for example, if someone's allergic to fish. So some common skin conditions and connections to gut health. Acne is a really interesting one. It's inflammatory hormones, genetic stress, and inflammation play a role in the development. I also, well, yeah, hormones, birth control. I see it a lot with people who've been on birth control. The gut and skin connection, dysbiosis can lead to inflammation and therefore acne flare-ups. So a safe bet for people with acne would be following an anti-inflammatory diet, limiting sugar. Anytime there's a potential overgrowth of a bad bacteria in the gut, sugar is going to feed that bacteria. So even if, you know, the only thing someone does when working with you is stop eating sugar, they could get some pretty big improvements in their health. Refined oils, processed foods, and simple carbohydrates are also going to be feeding bad bacteria or overgrowths in the gut. So limiting those, I mean, first of all, they're not good because they're inflammatory, but also they can feed overgrowths in the intestinal tract. So limiting those really gives you a lot of bang for your buck, and it's a pretty safe recommendation for just about anybody. Yeah, we have a question. How often should probiotics be rotated? So what I typically do in our practice is anytime someone runs out of a bottle of probiotics, I just give them another one to try. And we do probiotics that are multi-strain so that they're really getting a lot of different bacteria every time they're trying a new one, because there's trillions of bacteria in the intestines. There's no way we're ever going to hit them all. But if we're rotating and doing multi-strains every time, we have a better chance. Homemade kefir and yogurt probably are not enough just because we have so many things working against our microbiomes. But I definitely think like kefir, yogurt, sauerkraut, kimchi, getting at least a tablespoon of a probiotic food per day with a really high quality probiotic would be awesome. And that has benefits in the digestive tract, but also with the immune system too, right? So you really do get a lot out of taking a probiotic. Let's see. Oh yeah, probiotics for acne. There's some specific strains. This is really cool that are disease or condition specific. Lactobacillus rhamnosus for 12 weeks can reduce acne. It reduces acne forming bacteria, and it even has like direct benefits to the skin, which I think is so cool. So it improves the skin's moisture and the skin barrier, and it regulates insulin signaling. So what that means is it helps keep your blood sugar more steady, and the more steady your blood sugar is, the better you feel and the better everything in your body works. Sleep, hormones, stress levels, all of that can be made better by just regulating your blood sugar, which is pretty cool. Let's see, where am I? Like a tech class or something here. Hold on. Okay, psoriasis, a autoimmune condition that causes scaly patches of skin. Dysbiosis and leaky gut are commonly associated here. Individuals with psoriasis usually have less beneficial bacteria in their gut. And there are people where you want to be thinking about sources of inflammation and or toxic exposure. And that can be linked to genetic and environmental factors like stress and diet. So there's a whole lot. These psoriasis patients should really have a full functional workup. And with that, limiting processed foods, fats, and sugar can be helpful. Increasing fiber intake, but again, I'll probably say this a few more times. If you increase fiber in someone's diet and they feel worse, they really do need a functional workup. I would at least recommend a stool test, and considering prebiotics and probiotics for these people. But really, I would say a full functional workup would probably be more appropriate, because psoriasis is a pretty severe condition. Now, we have seen really good results with diet changes and psoriasis clearing, which is pretty interesting. I think, so there's a couple questions. What do I think about prebiotics? I think that prebiotics are very important. So probiotics are the good bacteria, and what we need for them to stay around are prebiotics. So probiotics actually eat prebiotics for energy and continue to stay present in the gut. So we really have to have both to maintain balance. If we don't have prebiotics, the probiotics have nothing to eat and can die off. And then how do you procure more specific probiotics like the lactobacillus for acne? Yeah, that's a great question. So we have an online dispensary, and you guys might even have access. Do you guys have access to FullScript? Have you heard of that?
Some of them probably do, yeah. I would think so.
We use FullScript. It's open, I think, to all healthcare practitioners. So I would look there. And there's even some companies, Metagenics is one that makes a specific probiotic for acne and for women's health. So if you're working with women, this is specifically, it's acne, also UTIs, the one that I'm thinking of. So there's definitely, I'd be looking at Metagenics and or FullScript to see if you can get an account. The cool thing, if you have a direct account with a company like Metagenics, they have sales reps, like I'm sure other companies that you guys work with, that can help you really target and make good recommendations. But again, also, as I'm saying that, not everybody benefits from probiotics. The wrong strains can make some things worse. So you really, really, really want to be careful when you're trying stuff out like that. You have to know what you're doing. You have to know everything that's going on with the client.
And
But
in the gut microbiome, the status, right?
yeah, absolutely.
Yeah. So
Yeah, there's a,
we wouldn't be able to see that. That would be the practitioner testing that, right?
yes, it would be with the testing and then making like a very specific recommendation based on that.
Right. With regard to the prebiotics, do you support prebiotics in a supplement, or are food sources better for prebiotics?
I think wherever you can get them. If a supplement's easier for you than making dietary changes, do the supplement. But the prebiotic sources aren't hard. I mean, bananas, artichokes, asparagus, they're just healthy things that we should be eating anyway. So it's not anything like difficult or weird to obtain. You just have to be intentional about knowing the sources.
Okay.
Let's see, psoriasis, rosacea, another interesting one. The connection here is gut dysbiosis, specifically SIBO. I'm so curious. Has anyone here heard of SIBO, or does anyone know what it is?
Yes.
Yeah.
Yeah.
Okay. Ah, okay.
We have
Um,
somebody besides me. Yeah, Laura says she had it.
yeah. So, Laura, I hope you had someone that really knew what they were doing with it. It's a condition where there's a bacteria overgrowth, specifically in the small intestine. It stands for small intestine bacterial overgrowth, and it's linked to rosacea. And whenever you have overgrowth of bacteria, of course, you're going to have inflammation, which leads to leaky gut, which is going to cause more problems. But there's actually 3 different types of SIBO. So if someone says they have SIBO, they need to know what type they have. Very recently, we found out there was a 3rd type, and like the protocol for each type needs to be very specific. Because if you do the wrong thing or take the wrong antibiotic or take the wrong round of herbs, there's lots of ways to treat it, but you can make it worse. So we really want to get with my clinic specializes in SIBO. There's other SIBO practitioners too, but we really want to make sure that anyone with, I mean, these really nasty conditions are getting the right treatment, especially if it's a case like this where it's linked to SIBO. Because if the SIBO gets worse, their skin's also going to get worse. You can guarantee that. So just a note there, if we do work out of state with other patients. Yes, so we can do that. And just common tips, I think, here to avoid inflammation would be, spicy foods and alcohol. Anytime someone has a skin condition, they probably have a leaky gut. Alcohol is going to make that worse. And it also sterilizes the digestive tract or the intestinal, the bacteria in your intestine. So it's going to be wiping out good stuff, leaving bad stuff to overgrow. And it's also whatever kind of systemic symptoms someone might have going on because of leaky gut, alcohol is going to make that worse too. I mean, it's literally a toxin that you're putting into your body. So if you're in a compromised state of health drinking alcohol, you are going to feel worse and your symptoms will get worse. So that's another easy thing, hopefully, for people to take out of their diets. Probiotics here can be helpful. And also a well-balanced diet that supports gut health can be helpful. And we'll look more about what that is in a minute. Why my slides are advancing? Sorry, guys. It's going. There we go. Okay, so nutrient deficiencies in skin health. This is a really interesting topic, also pretty nuanced, but basically micronutrients, so vitamins and minerals is what we mean here, play a role in supporting skin health. And when someone has skin issues as well as GI issues, they're going to have an issue with intake versus absorption of nutrients. So what I mean is that if the gut is inflamed and compromised, people can be taking in nutrients, but not necessarily breaking them down properly in a way that they can be absorbed. So just because someone has a healthy diet doesn't mean that they're getting everything that's in the diet, especially if they're dealing with something like constipation or diarrhea. Vitamins, minerals, and antioxidants, you guys know this, can protect the skin and manage inflammation. They can also help with blemishes and signs of aging. Benefits of a balanced diet, it helps with lipid production and collagen, moisture retention of the skin, can decrease inflammation, and also help to keep the microbiome healthy. And this is really interesting. So the RDA is what we use to help people figure out how much of nutrients that they need. And it was developed during World War II when we were concerned about the nutrition of our soldiers. And then we have dietary reference intakes, which tell us how much of a nutrient a healthy individual should consume. So if you're trying to figure out if someone is getting enough of something or how much someone needs, these are two common places that you go to kind of judge that. The RDA, it's nutritionally adequate for everyone, which everyone is very, very different. So the way we digest and absorb nutrients is going to be different. Our genetics can make things very complicated. So it's a marker and it has its place, but it's not everything. And with the dietary reference intakes, this is for a healthy individual, but most Americans, especially people dealing with skin issues and digestive issues, they aren't healthy. So their needs are probably going to be higher than the RDA and the DRI. So just a note there, we have to think a little bit deeper than just what's on the surface. So vitamin A is going to be a big nutrient of concern for skin health. Can be found in animal products and plant-based foods. It supports the gut lining, which is really cool, and it also promotes a healthy immune response in the gut. Helps with cell turnover, collagen production, and skin renewal. Helps to maintain elasticity, firmness, and healing. And it helps to manage wrinkles, smoothness, and hyperpigmentation. And it can be used in treatments for acne and keratosis. And then we find it in, typically we think of orange and red fruits and vegetables, but it's also in leafy greens, organ meats, eggs, dairy, and fortified cereals. And one thing I want you guys to think about too is the importance of someone just following a whole foods diet. I mean, if you're working with someone and want to make the most impactful recommendation you can for their health in terms of nutrition that's safe, it would just be starting to eat actual food. I mean, if you could just get someone eating whole foods, that is such a big deal. We have so many people that are so far off of the food chain in America, it's alarming. So just getting them to make that switch from, and I would never recommend a fortified cereal as a source of a nutrient because cereal is an overly processed food in itself, right? But, you know, sweet potatoes, carrots, leafy greens, if people can just get back to eating whole foods and make that the norm, they might not need a big intervention from a clinic like mine. It's really helping people just start to eat things that support their health and aren't harming their health. So I think that would probably be the biggest, safest recommendation you can make as an esthetician. And also too, just starting to look at your own diet and seeing like what you're doing and where you can make changes. And I'm constantly doing this as a dietitian, just playing around with the changes I make. And if I'm going to make try a new diet with someone, I'm going to try it before I give it to them. Just kind of, trying things out, see how I feel, see what's hard or easy for me about the changes that I'm making. It can really be interesting and impactful to kind of experiment on yourself first and then start like talking to people about it. Vitamin C is another really important nutrient for skin health. And you guys probably know this. It's an antioxidant, reduces inflammation, and it plays a role in oxidative stress. It helps with collagen production. It aids in skin structure and wound healing. Deficiency weakens the integrity of the skin, and it can also protect from UV damage and reduce wrinkles. And food sources, we think of fruits, especially citrus fruits. Tomatoes, bell peppers are a good source. Kiwi, strawberries, broccoli, and potatoes. And another thing too, when I think about vitamin C is I think about adrenal health. Adrenals are the system in the body that help us to relax, and vitamin C supports the adrenals. So this is a really big place too, where I think as estheticians, you guys can really step up and help people take part in their self-care and get into the kind of rest and digest mode. And kind of slow down. And I mean, that alone has really, really big impacts on people's health. So just helping them understand, like, what they're doing by taking care of their skin is they're really taking care of themselves. And that alone is just such a big step to someone improving their health. My opinion on health coaches is I think they can be very helpful. I think they provide a lot of accountability. They too are limited to general recommendations in terms of dietary changes. And I know that there are, it gets kind of complicated, but there are some practitioners who, in order to work across state lines with someone, if they're not licensed in the state that they're working in, they'll change their title to a health coach because health coaches can. So I also think it could be possible to be working with a health coach who might also be a chiropractor, if we want to use that as an example, that might have like extra training, but could also be, helping in a deeper way, maybe, and be more qualified to do that. I hope that's not confusing, but there's kind of a lot to that question. But yeah, I definitely think it can be helpful. I know a lot of clinics are using them to do more of the one-on-one work with clients and having doctors kind of like oversee the cases and having them more on the ground with people.
There's so many of these courses that are, I know, because I see it for naturopaths too, and it's like, be a naturopath in 2 days. Well,
Yeah.
that's a little hard to do. So I think, with the courses, if they're accredited, number one, and that to me, if someone wanted to do that, I know that from all kinds of training from a medical standpoint, the accreditation of the facility or the training is really important. And then, like you said, going across state lines, what are the laws in the state? And then scope of practice. So yeah, I mean, I think they are, I agree with you. I think they are helpful, but the crossover is real important. And it prescriptive language becomes a problem with regard to liability also. So this could be a whole presentation discussion that we could have, but that's a good question, Lindsay.
Yeah, it's a really good question. And yeah, I think it really kind of like what you were saying, Dr. Aaron, it depends on like the health coach. I think I would be investigating the background of that particular person because there are so many different ways to be a health coach. Some are more elevated and some are very like less credentialed.
Mhm.
see. All right, vitamin E, benefits for the gut. It protects your cells from oxidative damage and enhances immune function. In terms of skin health, it is going to protect from UV damage, reduce inflammation, and help with wound healing. It works with vitamin C to prevent collagen breakdown and premature aging. Food sources, nuts, seeds, leafy greens, and fortified cereal. And then the RDA down there is 15 milligrams, just to give you an idea of what that might look like. Okay, we'll go that way. Zinc is really important for skin health and for gut health. Zinc, just so you guys know, you have to be careful. I wouldn't recommend it by itself. First of all, it's not needed in really large amounts, but it's not common. I see it depleted in people a lot. But it has to be taken with copper because those two nutrients, if one gets too high, the other one will get too low, and vice versa. So you really have to be careful. You don't want to deplete someone's copper source being overzealous with zinc. Should always be given together. I'm sure you know it plays a role in immune function, also wound healing and skin cell turnover. Food sources are oysters, beef, fish, eggs, dairy, beans, nuts, and whole grains. Essential fatty acids, these are super important. A lot of people don't get enough. Reduces gut inflammation. They also help with the growth of beneficial gut bacteria. In terms of the skin, they help with hydration and inflammation. They support the skin structure, integrity, and barrier function. And they help with things like acne, psoriasis, and atopic dermatitis. So food sources, there's omega-3s. Got to be careful if someone has a seafood allergy. There's specific fish, you guys. This wild-caught sockeyed salmon is very specific. It's not just any salmon in the grocery store. In order to get these omega-3 benefits, it has to be wild-caught sockeyed salmon. As well as herring, tuna, lake trout, and sardines. Be careful with tuna if someone has a lot of skin issues. Mercury, I think about like mercury and detoxification. And then, of course, like walnuts, chia seeds, flax seeds also have omega-3s. Omega-6s, most people need to eat less of, but it does come from sunflower, safflower, soy, sesame, and corn oils. And most people are going to need more omega-3s and fewer omega-6s. So at our clinic, and I think any good functional clinic, you should be testing for micronutrient deficiencies, especially with skin issues. We can see what's really going on under the surface, and we're not supplementing blindly because that can also be harmful. It helps us to figure out nutrient deficiencies and see if there's any underlying factors affecting nutrient absorption. And the test that we use is really cool. It's Dr. Aaron, I don't know if you're probably familiar with it, the Genova Nutrival.
Yeah.
Yeah, it gives us markers for toxic exposure and even gut health. So just beyond nutrients, we're getting a whole lot of information about what's going on with someone, and it can really help us to figure out why they're having health issues. It's really, really interesting. So it's a great test. This is just a sample of what the test results look like, and we supplement accordingly. And just like a cool recent example of how we use this, it's not a skin related issue, but I have a gentleman in his 70s, and he has always been diabetic, and he's always had high cholesterol, and he cannot get his blood sugar down. He works really, really hard on it and cannot get it figured out. And we've been working, I mean, he's been wearing a monitor, a CGM, for a year, and he's slowly making progress, but he should be making a little more. So we have him doing his supplements, and whenever someone does the NutriVal, we retest them and reevaluate the supplements every so often so that they're at what they need, because obviously if you're supplementing heavily on something, your needs are going to hopefully decrease. All of his nutrients that were low came up, except for glutathione, vitamin C, and alpha lipoic acid. which is really interesting. So what we're doing, so those are all antioxidants. So clearly with this gentleman, there's some sort of oxidative stress or toxic exposure going on. Everything came up except for the things that would help fight against an exposure. So we think an exposure is there. And now he's doing some heavy metal testing to see if, and also some testing for mold in his environment to see if we can figure that out. But this is just an example of how something that looks like blood sugar dysregulation or looks like high cholesterol can actually be something else. And if we have the right tools to put all the pieces together for someone, we can really help make it so they don't necessarily, and we don't take people off of medication, but he might not necessarily have to be on metformin forever. If we can figure out what the toxic exposure is that's driving the inflammation, that's making his blood sugar high. So this is kind of where we go with all of this stuff. It gets really, really, really deep and really, really, really interesting. Let's see, we have a couple questions in the chat. Fresh milled organic grains for people with wheat intolerances, or should they go gluten-free? So Elizabeth, I think it depends on the person. There's a lot. I feel like I could talk for an hour on wheat and gluten, but I won't. So I think it depends on if they're reacting to maybe like the glyphosate that's in most wheat, then yeah, like fresh milled organic grains would be helpful. But if they have a true gluten or wheat intolerance or celiac, then that's a different picture. So I think it's something someone could certainly try to see if they get benefit from or don't have a problem with that type. But if they do, they might need to go the other route and cut it out. I think it would just depend on the person. Hair analysis for nutrient deficiencies. We do blood and urine samples for nutrient deficiencies. I know there are some practitioners out there using hair testing that really like it.
I do HTMA.
What is it?
I use HTMA, but it doesn't do it doesn't do specific nutrients. It does nutrition ratios in an algorithm along with heavy metal. So it's not like Jenny's test that she's got here. It doesn't, and it takes a lot of interpretation to look at these HTMA tests. But what Jenny is using is much more precise. The HTMA looks at ratios in regard to symptomology along with the heavy metals. So
Yeah.
they're not as they're great. They're a great tool, but not like this test that you're showing us.
Yeah, I know a lot of practitioners using the HTMA that absolutely love it. I think there's lots of different types of tests out there that are certainly all good and like legitimate tests. Yeah, so there's lots of kind of different ways to look at things, but I do think, with skin issues, micronutrient testing can definitely be something that's warranted. So some tips for the skin and gut health. I think first and foremost is staying within your scope of practice. So focusing on skin health and not providing specialized nutrition recommendations. You can offer general nutrition tips like we spoke about earlier, without giving specific medical or dietary advice. Registered dietitians are the go-to for nutrition plans. To be a registered dietitian, you have to have a master's in nutrition. That's actually a new requirement of this year. And you have to pass a national registration exam. You have to be licensed in your state, and you have to complete a 1,200-hour internship. The title nutritionist can be used by anyone. It's not necessarily a credentialed title. It could be, but anyone, I mean, you guys could call yourselves estheticians and nutritionists if you wanted to. It's not regulated. So just be aware of that when you're referring out. You want to be looking for a registered dietitian because this is another one of my favorite sayings, but you don't know what you don't know. Just like that really nuanced copper zinc thing I was talking about, or the fact that fiber can make digestive problems worse and what that might mean, or that certain probiotics can make things worse for people. You don't want to be dabbling with someone's health and making them feel bad because you didn't want to refer out, or because you went too far outside of your scope of practice. That's not fair to the client. And it certainly isn't even legal. So we certainly want to stay within your scope and know who to refer to and when to do that. So safe things to talk about. Hydration is always a win. Antioxidant-rich foods should not hurt anyone unless they have an allergy. Highlighting gut health and really, I mean, getting people thinking deeper and trying to connect their own pieces of their health puzzle can be really interesting. And skin supporting nutrients, like we talked about today, can be really, really helpful. Emphasizing food over supplementation. And also, I mean, if people just started eating actual food instead of processed versions of foods, it would just make all the difference in the world. It really would. It would decrease inflammation. They would be absorbing more nutrients. It would be supporting gut health. I mean, it could really turn someone's life around to just start eating actual food, and also to just be aware of when that they haven't been eating actual food. It can be really eye-opening to go to the grocery store and just look at food labels of things that you normally buy and see what's in there. Because most of it is overly processed and it has things in it that are inflammatory and not good for you. So cleaning up the diet, again, eliminating processed foods, trans fats, commercially made baked goods, soda and fast food. I mean, even if someone just gets off of soda, there's these small changes that people can make that for so many reasons can have really big impacts. Decreasing sugar intake can be a big one that can really help the microbiome, and inflammation. Decreasing or eliminating alcohol is kind of an easy win, hopefully, for most people. Stress management, people I don't even think realize how stressed they are. So just getting someone to practice stress management, or, you know, elevating the way that you look at your role in their life as helping people practice stress management can be really impactful. Getting enough sleep and just moving more can be a really big deal for people. The basics, again, I'm really big on eating actual food, so whole foods, with high quality protein. We usually recommend 30 grams of protein per meal. It's starting the day with a savory breakfast. That's a really good tip instead of a sweet breakfast for blood sugar balance that anyone can do. It's not going to hurt them. Healthy fats, vegetables. If you eat your vegetables first, it helps your glucose response even more. So that's another good way to balance blood sugar, is see improvements in skin health. Eating less frequently is good for your blood sugar, but also for your digestive tract. So we recommend, instead of a lot of mindless grazing, that people wait at least 4 hours between meals. It's a pretty safe one. Anyone would benefit from that. And letting your digestive system rest, and that kind of goes along with the point above. More on lower glycemic foods, berries, apples, green veggies, lentils, chickpeas, sweet potatoes, and, you know, diets that support that type of eating, paleo, Mediterranean, and ketogenic, can be beneficial for skin health. More healthy fats and decreasing less healthy fats. So we're thinking, again, those omega-3s, fatty fish, chia, flax seeds, probiotic rich foods. So someone brought this up earlier. Kimchi, kombucha is another good one, sauerkraut and fermented pickles. And then this is an interesting topic, food sensitivities and inflammation. This is a way that we help people who are having the kind of like the leaky gut scenario, where you just have a lot of different symptoms going on and you can't figure out why you don't feel well, and no one can really put the pieces together. And, you know, maybe you have eczema and migraines, you know, just kind of random things going on. We can actually run blood work to figure out what foods in the diet contribute to inflammation, and help you build a personalized anti-inflammatory diet based on your blood work, which is really cool. This is a game changer for a lot of our clients in helping to heal leaky gut and stop kind of bothersome, persistent symptoms that there's no real like rhyme or reason for. A couple of chat questions.
Yeah, any dietitian blogs that you like to send clients to for healthy recipes?
Yeah, actually,
That's a great question.
that's a good one. The Real Food RDs, type it in here. I think it's just the realfoodrds.com, but that's one. And then I really like Allie Miller.
Mm.
She does a lot with keto, real food, food is medicine. And she has a great podcast too. Yeah, that's a great question. And like there's another one, this is a fun one. You guys will like this. Her name's Chocolate Covered Katie. And she's a food blogger who does like healthy versions of desserts, but
Mm.
they're like real food desserts. So she might use like maple syrup or like coconut sugar or offer like, or bananas or just, something cleaner, but it's also like a really like legitimately good recipe. She has really good avocado brownies and black bean brownies and, just better versions of like people's, things that people like. So it's kind of a fun one.
Like chocolate mousse from made out of pears.
Yeah. Exactly. Yeah, they're good. Um, yeah, and just things to watch out for referrals. Skin conditions that are chronic or severe, definitely send to a functional practitioner, whether that's our clinic or another one. Get your clients the help that they need. It's definitely something going on the inside. If someone's really interested in nutrition advice or overhauling their diet, be sure to send them to a dietitian. If someone's had unintentional weight loss, encourage them to go to the doctor. And if someone has been trying to treat their skin for a while and hasn't seen results, then they need to go see what's going on the inside. So functional practitioner, again, whether it's us or someone else, just make sure that people are getting, what they need to improve their health, because that's a sign for you guys to realize that something else is going on. And in terms of a referral network, dietitians, dermatologists, other healthcare professionals can support your clients, which will help you to stay in scope while supporting them in the best way possible. And for dietitians, I would look for one specializing in functional nutrition or skin health specifically. So as we're wrapping up, it's important to recognize the role that the gut plays in healthy skin, and a healthy gut microbiome is going to be key to reducing inflammation and improving skin barrier function, and also supporting overall skin health. And estheticians can educate clients on the benefits of nutrition. Always remember to refer to a functional dietitian